World Hepatitis Day is observed each year on 28 July to raise awareness of viral hepatitis, an inflammation of the liver that causes severe liver disease and hepatocellular cancer. This year's theme is Hepatitis Can't Wait. And joining us for more on this is public health expert Adegbami Oluwatobi. Good to have you join us.
Good to be here.
All right, so we understand that even with the COVID-19 pandemic, we still have about one person dying every 30 seconds rather, due to the hepatitis-related diseases. We also know that now in Nigeria, we have about 20 million hepatitis-related cases. Talk to us about what this is, what is hepatitis, how do people contract it, and if there is any available treatment for it.
So hepatitis itself means inflammation of the liver. All right, the liver is a vital organ of the body. All right, it helps process nutrients, it filters blood, and then fights infections. And then when the liver is inflamed or when it's damaged, and then we are talking about hepatitis. Now, hepatitis could be caused from heavy alcohol use, some toxins from medications, and of course through the virus, hepatitis virus. Now, there are 5 strains, hepatitis A, B, C, D, and E, but the ones that are much more prominent around here is A and B, and A, B, and C actually, but B especially is the one that has a major focus because most of the hepatitis cases, B is the most popular, and B is spread via body fluids. Now, when you share sharp objects with people that has not been tested, in fact, should not be sharing sharp objects at all with anybody. And through sexual intercourse from mother to child, and basically these are the major ways through which hepatitis can be infected. And you could protect yourself against hepatitis B especially because there is an effective vaccine that can, if taken 3 doses spread through 6 months, can protect one for life. And that is why the awareness about hepatitis needs to be done, because as we speak, like you rightly said, that one person dies every 30 seconds from hepatitis. And the noise about hepatitis is not there as much because sometimes it takes such a long time to know, all right? In fact,
and that's where I was just going to, because we have some level, I mean, we just have this particular habit, I think maybe it's a Nigerian thing, where, you know, when you have symptoms of a particular ailment, because you can relate to them, maybe they look like that of something else, you think it is something else and you treat it by yourself. People really don't like going to the hospital. So what are the signs and symptoms to watch out for?
Okay, so now for hepatitis especially, all right, you may not notice any signs and symptoms early. Okay, so by the time you are noticing signs and symptoms for hepatitis, then it's already too late or almost too late, because you have to be on regular treatment and monitoring consistently. So that is why for hepatitis, I wouldn't ask anybody to be waiting or be looking out for signs and symptoms. I would say everybody should be tested. Get tested immediately. In fact, WHO is saying hepatitis can't wait. That hepatitis can't wait slogan is there because the burden is too much to just allow it to be, okay, maybe when I fall ill or maybe when I have some symptoms. No. For hepatitis, most of the time, when people know the liver is already badly damaged and there's almost nothing that you can do except liver transplant, which is a complete different talk about liver transplant, especially in Nigeria. So we should be focusing on prevention, and that will mean get tested, and if you are negative, get vaccinated immediately.
So, again, when it has to do with finance, people always prefer to understand. I mean, they feel like, look, when it has to do with finance, it might be too much, especially when you do not have a lot of money. We understand how the economy is right now. Talk to us about where the testing can be done and the process of vaccination and what it might likely cost if people have to pay for it.
Okay. All right, so depending on your location, I understand that the prices differ, all right, depending on where you are. But one thing that I know is people are partnering, all right? A lot of organizations. I know Rotary Club is doing a lot right now on hepatitis. I know Emerson Pharmaceuticals is doing a lot right now on hepatitis. health bodies like the Young Pharmacists Group of PSN is doing a lot. ACPN, that's Association of Community Pharmacists of Nigeria, they are running several outreaches around the country right now. If you are in Lagos, I understand there are some market outreaches. We are taking this hepatitis campaign to the people, wherever you are, in the marketplaces, at the hospitals, in the churches, in corporate organizations. A lot of it is going on now. So if you want me to, I can mention some specific places. I know in Oshodi Market right now, free hepatitis screening is going on there right now. In Tejosho Market in Yaba, right now, free hepatitis screening is going on there too. And I understand that they are giving vaccines out at as cheap as 1,000 naira per dose, which is almost nothing. It's recharge card money. And it is a worthy investment for your health and for the health of the people around you.
All right, thank you so much. So for those who, people should just keep their ears to the ground, find your nearest location, get tested and get vaccinated for little. Thank you so much for talking to us. Public health expert Adegbami Oluwatobi.
Thank you so much for having me. It's been a pleasure.